My name's Andrea and I'm Organisational Manager here at Always Another Way, which is part of the West Cumbria Mental Health Partnership. We've been operational now since 2016 and we provide preventative low-level mental health support across Copeland and Allerdale. Waiting times for those statutory services are really long and often people just don't have that time to wait for that. To access our service, usually a waiting time is usually about anywhere between, say, 4 weeks to 6 weeks.
So I started working with a client back in December. They were struggling with their routine after they've lost their partner. And so since I've been working with them, they've gone back to work part-time. We've come up with coping strategies around their bedtime routine. It's just a lovely journey that they're going on, and I feel privileged to be part of that journey to help them.
My name's John. I moved here to Cumbria in England about 15 years ago. My partner developed cancer and passed away in August. It was a devastating thing to have to deal with, Didn't even set foot out of the house for 4 months. Never even went out the door. But then after a while I was referred to Always Another Way, and we didn't try to tackle too much at once. She was really good at helping me just identify little things that I might be able to do differently to help me start to not get over it, but move on and continue.
I'm Sellafield. I'm an architectural technology student at Nottingham Trent University. I started with a series of meetings with someone called Nick. This was looking at getting an autism diagnosis as well as mental health diagnosis, because I knew I'd struggled with these problems for a long time. And it was also looking at contacting the gender services, because I'd kind of been blindsided by them. Then I had some appointments with Lyn, which was also looking at employment, because I was struggling at that time to find a work placement, and she helped me with that. So I've gotten somewhere with a lot of things that I've been wanting to do for years. Always Another Way helped out quite a bit with that. Cumbria in general is quite lacking in terms of mental health services and things like that, and I think Always Another Way are a really good resource to have.
I would just encourage people, if you're dealing with something that you think you need some assistance with, give it a try. What have you got to lose?
What we would ask somebody to do is go to the GP and ask for a referral through their social prescriber, and then social prescribers refer to us.
So I'm Janine Ward. I'm one of the founding directors of Together We, and we are part of the West Cumbria Mental Health Partnership funded by Sellafield. Me and my sister Samantha Jockin, who's the other managing director, could see a really big need for people's mental and physical well-being. So we were like, right, why don't we do something and give people what they need really to keep themselves well and empower them to take control of their mental and physical well-being. So we have several different areas of Together. We've got Together We Talk, Together We Fitness, Together We Recover, and Together We Carry.
Hi, I'm Charlie. I work for the North Cumbria Recovery College, which is a part of Together We. So the Recovery College aims to improve people's mental health and well-being through courses like RAP, which is Wellness Recovery Action Planning, Decider Skills, Assertiveness. You have to enrol in the courses, but you don't have to be referred, so you can just self-enrol.
Together We Talk is the one that probably most people have heard of. If somebody isn't getting any psychological support anywhere else, then we will see them. So we've got Together We Fitness as well. Now Together We Fitness, we have locations all across West Cumbria where we deliver low-level impact exercise. And the last one is Together We Carry. And what it looks at is things like prenatal and postnatal mental health and well-being. It looks at physical exercise during those times.
During a horrible time when I was kicked out by my parents and living in a hostel, I spoke to one of my friends who used to work on the fitness side. She said, have you ever thought about getting therapy with Together We, talk and exercise therapy?
You can access Together We through so many different ways. We do self-referral, professional referral. You can go on our Facebook pages, ping us a message.
And I've known a few people who are trying to get into the Recovery College or Together We. I just say, pick up the phone, I just say, just ring them and we'll get you sorted.